Hi everyone, this is Tim, your Block 3 lecture instructor, and I wanted to make a PowerPoint voiceover on the clinical replacement calendar, just so that way, I figure if I repeat it a couple times, it makes a little more sense, and that way no one's lost. So, plus this is probably a good way for the clinical instructors to kind of get an idea of what I want from you, and then they kind of know what they want from you too, and then we kind of put everything together. So for the thing that you see here, the clinical replacement calendar, again, week one, this is the week of January 24th. So essentially, clinical replacement is every Wednesday. So for week one, it's 127. For week two, it's February 3rd. And for week three, it's February 10th. Week four is February 17th, and so forth and so on. So it's the week of, and like I said, every clinical replacement day is on Wednesday. It works out best for you because Monday, Tuesday, Wednesday basically our class days, lab days, and clinical replacement days. And then between Thursday and Sunday, except for the quiz, you pretty much are on your own, whether it's trying to coordinate babysitters or work or what have you. At least you don't have to worry about us trying to break up your week. So now, as far as week one, which starts a week from this coming Wednesday, we're going to do the renal medications, renal case studies, and the VSIMs. The VSIMs I actually sent out, or at least gave you guys the codes for that. That will be given to you the day of clinical. The reason why is because if I give you the name now, you guys do it, and then you find out that it didn't really count as credit, and then you have to redo it on the day of, and it's meant to actually be counted towards your clinical hours. And like I said, if we do it on the day that it's actually due, then it kind of cuts up your day a little bit and allows you to do both. I will forewarn you also that when you do your VSIMs, make sure that you do jot down stuff as you do it, whether it's labs, radiology, diagnostic studies, anything that's actually something that you would need for DocuCare, because if you don't jot stuff down, you're trying to do it from memory, and then when it comes to DocuCare, you're forgetting, and then you have to redo the VSIM. So jot stuff down as you go, so that way it's easier to do your DocuCare later. Um, I do want you to have on the pre-test, post-test, and the VSIMs at least a 90% or higher. They're fairly easy. They shouldn't take too long. Some students get some stuff out of it, and some are like, oh, okay, I've been there, done that. So, but again, it does count a lot towards our clinical hour and making sure that we have as much close to 60 as we possibly can. Now, as far as renal medications and renal case studies, you can actually find those under Canvas. And let's see here, if you go down to past the labs, here's your case study. So for renal, we're going to do the UTI case study and the dialysis case study. If you pull those up, it gives you a scenario with all your labs. It gives you questions. I want you to have these done before you come to clinical replacement. It makes the day go a little bit smoother. It allows the clinical instructor to be able to ask you questions and to be able to go into more in depth. The idea is for you to get a different perspective of things that we've actually covered in lecture. I do like the fact that we have between Darren and myself and Hannah and Cindy. I like the fact that you're having different instructors from different aspects of nursing teaching you, because I think that getting different perspectives gives you more of that gray thought process. Nothing's black and white. Every patient's different. Every scenario is different. Things may happen with one person. Someone may do something a little bit differently. We all have a reason. So I like the fact that you're getting good information. You're getting good information from different perspectives and different nurse educators. So like I said, if you actually get this done earlier, then you guys can go into more depth, talk more about things that Darren may see or I might see being in different areas of the hospital and stuff. So definitely have those done. Now, as far as the medications, if you actually go down to, let's see here. Go down to past the lab, past the case studies, past the lecture handouts, MedSurg content. If you go down to here where it says renal medications PowerPoint 1, PowerPoint 2, and then renal medications list. Your renal medication list, I made the list because there are so many meds for renal, and there's also a list for GI. There's so many of these meds that it's easier for me just to put it on one piece of paper and allow you to be able to look that stuff up. But that doesn't mean that you can't look up or know the other meds. There's a renal medication PowerPoint and a renal medications 2 PowerPoint. Make sure you go through those. Make sure that you know those meds also. Those PowerPoints were not made from me, but I also think that they were actually a pretty good mixture of medications for renal. And like I said, just familiar yourself with them. I also put in here an updated fillable medication sheet. This will help you in the sense you can either use it or don't, but I like it because of the fact that it pretty much keeps it kind of down and dirty. I did actually fill one out, and let's see if I can find it here. And this is, I figure if I give you an example, it might be a little bit easier for you. So I just chose Levaquin. Levaquin is a fluoroquinolone. When I think of flora, I think of natural flora in your body, whether it's you have natural flora in your mouth, you have it vaginally, and you have it rectally. So orifices of your body are meant to have natural flora, and it's supposed to be, kind of a good bacteria. But with Levaquin, you could start to kill off that good stuff. So you want to make sure that your patients are taking some sort of probiotic, making sure that you're checking for thrush, making sure that you're eating the yogurts and the things with natural cultures in it, because it will keep your gut and your intestinal tract flourishing and keeping things, kind of balanced, I guess. I put on here that it was a broad spectrum antibiotic, and it is for bacteria. I found that it was normally for pneumonia, bronchitis, sinusitis, and urinary tract infections. Between complications and contraindication precautions, I found that they kind of went hand in hand, or at least kind of said the same thing. So for complications, I put so neuropathy and seizures was probably the biggest two that I saw. For muscular problems, they also had tendon ruptures. It's processed by the liver, but it's excreted by the kidneys. So you want to make sure that your patients have good liver function and good kidney function. So AST, ALT, binding creatinine, making sure all that stuff actually works. There is also photosensitivity, which I thought was very interesting because we live in the sunniest state in the country. Interactions, I saw that antacids can actually reduce the effectiveness. So always take your antibiotics probably about 2 hours before, 2 hours after. That way you're able to, kind of not have them really touch each other or interact with each other. It also enhances Coumadin. So if your patient's on Coumadin and their INR levels are actually therapeutic and really good, you might want to watch out for Levaquin and see if that actually makes it, I think it actually makes it work more, so your blood will become thinner. Evaluation of medication effectiveness, you're going to definitely do blood cultures, or you might do a urinalysis and see if the actual infection's gone. Levaquin is given PO and IV. You don't necessarily need to know the medication amount as far as dosage, but it's kind of good to know. So 250, 500, and 750. Nursing interventions, I put in here, make sure that your patient's on a probiotic. It's given IV or PO. Usually they'll give it every 12 to 24 hours, and you want to make sure that you assist the patient when ambulating if it does truly cause neuro or muscular problems. And for client education, making sure that grandma takes all the antibiotics, make sure that even though she feels better, she needs to finish the actual dosage. And then make sure that she takes a probiotic at home and also gets some sort of good cultural bacteria, which is, the yogurts, cottage cheeses, milk, things like that and stuff. So, but like I said, if you got to write 3 pages, you wrote too much. And like I said, if grandma doesn't really quite understand the information, then you're not really doing her or you any good. So, and let's see here. Let's go back to our clinical replacement. So for week 2, January 31st, that week of on Wednesday, GI meds, same thing, GI case studies. You also have VSIM. For week 3, we have insulin and heparin math. That actually can be found on, going back to Canvas. And it should be all the way up to where the math is. So Med Math Resources, you get your heparin and insulin practice sheets. This actually came from your Med Math book. Page 281 was the heparin, and I think the insulin came from 283. So again, I mean, this came from your book, making sure that you understand the protocols. I think you'll be fine. This is actually not on test one or test two, but this is on your final. I actually copied the protocols out of the book and then changed the number of the questions. So for the most part, as long as, like I said, as long as you know how to do the math, you will be fine. And let's see here, what else we got? So for week 3, we're also going to do neuro case studies, men's health and cancer hematology case studies. Again, I think that these case studies at home, doing them before you actually come to clinical replacement, it probably will take you about an hour or two. I think if you guys got your groups together and actually did them outside of clinical replacement, looking stuff up, helping each other out, I think that it might actually work better and save you a little bit more time. As far as simulation, that's on week 4, which is February 14th, which essentially is February 17th, which is a Wednesday. Simulation is going to start around 6 or 7 in the morning, and it's going to last until roughly 6 or 7 in the afternoon or evening. And then we also have a little bit of a break, and then week 5 is March 10th, and there's another simulation. I think you'll actually like simulation. It's almost like Jerry's day in the ward, but more of your clinical instructors it's almost like a round table type thing. We're really just kind of going from one room to the other, talking to the patient. They call it nurse modeling, but your clinical instructor will kind of tell you what they're doing, why they're doing it, and then ask you questions as they go to kind of see how much you're following along. So I think it's going to be good. I think it's going to be, I don't want to say fun, but it's going to be pretty educational and pretty worth your while. I also think that it's much better than we've done before. So I think that you'll like it. All right. Well, I think that's it. So if you guys have any questions, let me know. And like I said, I think if you have all your stuff ready to go before the clinical replacement day, I think it just makes your day go a little bit smoother. And we'll go from there. So I'll talk to you later.